Representative Cheeseman of the 37th District. You have the floor, madam.
Thank you very much, Mr. Speaker. I have a feeling that anyone who serves on the Real Estate and Insurance Committee is going to think this is Groundhog Day because they have heard me speak on this bill at least twice already. I testified at the original public hearing. I participated in the listening session. I was one of the early co-sponsors because I am passionate about this. I know only too well the terrible toll uncontrolled diabetes takes on a person and a family because I watched my late husband suffer the complications. He was so afraid when he served in the military of losing his sight or losing a limb. And yet he said it was the ultimate irony that he developed a disease where those are two of the most common complications. And before he died, he was losing his sight. Thank God he never lost a limb, but he suffered from terrible diabetic neuropathy, which is like walking on knives. He was in end-stage renal disease. I heard Representative Curry talk about being in end-stage renal disease. That is one of the most common complications of diabetes. He too was on the transplant list at Hartford Hospital. They were terrific. Unfortunately, he died before he could receive a kidney. So this disease takes a terrible toll. And the way you stop these complications, the way you prevent the blindness and the amputations and the kidney failure is by having that insulin that preserves your kidneys and your eyes and your limbs and stops the heart disease. So the idea that this drug, this hormone that was discovered in terms of being able to treat diabetes almost 100 years ago, and Frederick Banting, who discovered it, felt this should be available to everyone, that we have seen the cost skyrocket for, in effect, the same drug, that families have to watch, as my good friend, Representative Pavelak D'Amato, see family members ration their use of this drug when it doesn't have to happen. I've heard conversations about, well, if we do this, insurance companies will just pass the costs on to other people. We do this every time we mandate that something be covered. When we mandate that an infant receives some sort of diagnostic procedure that will prevent terrible complications down the road, like PKU. We accept that preserving the health and welfare of other people in our society may incrementally affect others in terms of cost, but we don't fail to do it. And the savings we will have in terms of human suffering, in terms of increased life. My husband had numerous laser treatments for his eyes at $500 a pop. He had 2 vitrectomies at $15,000 a pop. You could go on and on about the cost of treating these complications, and that cost will dwarf the amount that we'll have to spend to cover the cost of insulin for these people. So this is an investment in saving life, in preserving health, and at the end of the day, in saving money for the state and the national government. So I am in strong support of this bill. I want to thank the leadership of the committee. I want to thank the leadership on both sides of the aisle. I want to thank the governor for calling this in special session, because until you've experienced this, until you've seen someone suffer the complications and lose everything that he loved in life, then I don't think you can understand this. And I urge everyone in this chamber to support this bill. Thank you, Mr. Speaker.